On the evening of February 19, 1994, a woman named Gloria Ramirez was rushed into the emergency room at Riverside General Hospital. She was only 31 years old and suffering from late-stage cervical cancer. Doctors immediately noticed that her condition was critical. Her heartbeat was dangerously fast. Her blood pressure was dropping. She struggled to breathe as medical staff rushed to stabilize her. But within moments, something inside the emergency room began to feel terribly wrong. Several nurses noticed a strange, oily sheen covering Gloria's skin. Others reported a powerful, garlic-like odor coming from her body. When one nurse drew a sample of her blood, she claimed it carried a strong ammonia smell. Then the situation became terrifying. One by one, hospital workers suddenly began collapsing. A nurse felt dizzy and fainted. Another experienced severe nausea and muscle spasms. Doctors complained of burning sensations, shortness of breath, and confusion. In total, more than 20 medical workers became ill that night. Some had symptoms so severe they required hospitalization. One doctor, Dr. Julie Gorchinsky, reportedly spent weeks in intensive care after exposure. The emergency room was partially evacuated as panic spread through the hospital. And at the center of it all was Gloria Ramirez. Despite desperate efforts to save her life, she was pronounced dead only 45 minutes after arriving at the hospital. But the mystery had only begun. Authorities immediately launched an investigation. The first theory was that some kind of toxic chemical had contaminated the emergency room. But no obvious source could be found. Some investigators suggested the hospital staff had suffered from mass hysteria caused by stress and panic. But many people rejected that explanation. The physical symptoms were too serious, too real. Months later, scientists from Lawrence Livermore National Laboratory proposed a controversial theory. According to their findings, Gloria may have been using a chemical called dimethyl sulfoxide. DMSO was sometimes used as a home remedy for pain relief and was known to produce a garlic-like odor. Researchers believe that oxygen administered by paramedics may have triggered a chemical reaction inside her body, transforming the DMSO into a highly toxic substance called dimethyl sulfate. If true, the vapor released during treatment could explain why doctors and nurses suddenly became sick. But there was a problem. Many scientists argued that such a reaction should have been impossible inside the human body. The transformation would normally require controlled laboratory conditions, not an emergency room. Even today, experts continue to debate whether the explanation was scientifically realistic. And that leaves one disturbing question unanswered. What really happened inside that hospital room on the night Gloria Ramirez died? Decades later, the case remains one of the strangest and most unsettling medical mysteries ever recorded.